Good morning. Today we'll be talking about dementia, which is something that is fairly common, but we need to know a lot more about. Thank you, Dr. Ajala, for coming on the program to talk to us once more. It's always a pleasure to have you with us.
You're welcome.
Now, we're talking today about dementia. You know, I think it's something that when we were talking about aging earlier, we sort of touched on, but we just want to talk a bit more about dementia and Alzheimer's. There's a lot of confusion. What is dementia? What is Alzheimer's? Are they the same thing? Who does what affect? And so on. So can you just sort of clear that up for people? What is dementia and how does it differ from Alzheimer's?
Okay, so the way I try to explain this to people is to use another term. So dementia is a condition that affects the brain and manifests in a certain way. And there are different causes of dementia. So for instance, if you have a fever, you could have a fever, which is the way you present. So you present to hospital with a fever. And people say, oh, she's got a fever. So that is what you've come to hospital with. And we know you have a fever because your body temperature, your core body temperature is quite hot. Then there are different causes of that fever. It could be malaria, it could be lymphoma, it could be tuberculosis, it could be so many other things, autoimmune diseases like rheumatoid arthritis. That is the way I try to describe dementia and Alzheimer's. So dementia is a general term for a condition that affects the brain. People manifest in a certain way with dementia. So people manifest with what we call cognitive impairments or memory loss, memory problems, behavioral problems, sometimes emotional problems. And it's a debilitating disease. It's what we call a neurodegenerative disease, a set of symptoms presenting in a certain way caused by diseases. So Alzheimer's is a cause of dementia. Alzheimer's is the commonest cause of dementia worldwide. There are other causes of dementia. There's vascular dementia, which is caused by damage to the blood vessels of the brain. There's something else called Lewy body dementia, which is a different cause of dementia. But dementia in itself, for us to say you've got dementia, you have to have presented with certain things. Memory loss, not being able to function in certain ways, not being able to sometimes look after yourself, not being able to, behave in certain ways. People forget how to do certain things. And ultimately, dementia as a condition leads to death, because people can get to that point where they actually forget how to eat, drink, swallow, and so dementia can lead to death. But dementia is just a general term for, a condition that people manifest with. We say, oh, this person has got dementia because they have presented in this way. They've got loss of memory, they can't remember things, they're behaving in a certain way, the way they're functioning, can affect the way they walk, talk, behave. Yeah. So
now,
I hope that clears that
up. Yes, it's cleared that up. I think that makes it quite clear that dementia is sort of like an umbrella for a number of conditions. But the issue or what we'd like to know a bit more about is, how does it manifest? You've talked about memory loss. Is there an age at which it starts? Is it more common in men or women? And, is it progressive? Because a lot of people, have memory loss. Does that mean they've got dementia? How do you determine, or how can you distinguish between just normal memory loss or stress memory loss or an actual problem that people need to seek help for?
Well, I always say that by the time people have an issue with their memory that is actually affecting their day-to-day living.
Can you give an example?
So if, for instance, someone can't remember, sometimes people say to me, oh, I'm forgetting things. They're very worried. I'm forgetting things. I keep forgetting things, but they're working. They work, they're doctors or, accountants or whatever. They're able to function normally. They just forget things like, oh, they can't remember where they put their glasses, or they can't remember where they put their keys. Things like that can happen because you've just got a lot on your mind. When it becomes a problem where, the people around you or the people around this person actually start to notice that there's an issue. So it's become something that they notice it's actually affecting their lives. Some people get to the point where they can't function, so they can't carry out executive functions. They find that, their family members find that, first of all, they can't remember people's names, people around them. So not people they haven't seen for a long time, people around them, like, people in the house, they can't remember what they had for breakfast. They go out and, can't remember where they are. Sometimes maybe even within the house, they can't remember how to, say, get from their room to like the bathroom. It's actually affecting their day-to-day living. Then there's a problem, Some people can't remember. They start to lose things, lose money. They keep something somewhere and they can't find it. They actually can't find it. It's not just a case of, oh, I think I misplaced my key or whatever. It's actually becoming a problem for them and the people around them. Then it's not just a case of simple, oh, I just forgot this. It's actually an issue. It's actually
so if we can talk a bit about it, because I think you've explained how it can, progress and lead to death, and which is also quite alarming. I mean, but I think the number one question a lot of people's minds as they're listening to this is, I mean, is dementia preventable? Is it inescapable?
So a lot of research has gone into dementia over the years because it is such a big problem worldwide. And the evidence shows that about approximately 30% of dementias are preventable. Approximately 30% of dementias. There is a genetic factor to dementia like Alzheimer's. So, all we can do really is just try and go with the evidence of the research of what's been done and just work with that and do the things that we know can prevent this 30% of,
Can you give examples for people listening? What are the kinds of things that they should be looking at? How should they be, working on this issue of dementia to prevent it?
Well, I think I'm just going to not because we don't have that much time. So one of the things that has been proven to be beneficial in reducing your risk is things like physical activity, exercise. So there are lifestyle changes that one can adopt. So physical activity, exercise, diet, eating right. I mean, when I was all those years ago, we used to talk about the Mediterranean diet, which basically just it's basically just green leafy vegetables, etc. Cutting down on toxins, smoking, reducing the amount of alcohol that one consumes. Other things like we talk about brain boosting activities, brain boosting activities. So maintaining a good social life, not living in isolation. We found that people who have untreated depression can end up later with dementia, and people who have hearing loss that is not attended to can also end up with dementia. Those are things that one can work on. For us in Nigeria, or when it comes to Nigeria, what I found over the past 5 years is that when we do scans of most of our patients, so most of our patients tend to have what we call vascular problems. So in the brain, when you've done an MRI head, you see that there's lots of people have had problems to the blood vessels of the brain from things like poorly controlled hypertension, polycontrols, cholesterol, what we call vascular risk factors. So all those things need to be addressed. Lifestyle, physical activity, exercise. For me, I think exercise is key. Exercise has many benefits. One of the benefits is in reducing that risk of developing dementia in later life.
Thank you, Sister Yinka, for coming on the program to share your experience.
Thank you very much. I'm Dr. Akande-Ajala, and I have to introduce Sister Yinka Williams. Her name is actually Architect Yinka Williams. She's a professional, very distinguished lady who I admire her so much. So I came to Nigeria with as a professional, as a consultant geriatrician, to come and impact the healthcare service in Nigeria for older people. And I met Sister Yinka in Nigeria. Now, she's also the big sister of one of my colleagues. We went to medical school, advocate for dementia management and care. I am sure she knows more than I do, actually, about dementia, because she has spent years researching, traveling the world. She travels the world to attend conferences, courses on dementia research. She knows so much about it, the management. She has looked into all sorts of, every single aspect of dementia management and care she knows about. And she's an architect.
Fantastic.
Yes, she cared for her late father until he passed away. She's like,
thank you.
Yeah.
Thank you very much. I must say,
I hope I've done that justice.
You've done a phenomenal job. Thank you to talk to you, yes. Sister Yinka. Sister Yinka, thank you for being our hero. And can you just share with us your experience? What you went through, and why you have gone on this journey?
Thank you very much, doctors, Dr. Olutoyin Akande-Ajala and Dr. Pamela Ajayi. And thank you, everybody, for inviting me over. I'll just go straight to the point. My dad was diagnosed in 2010, but before then, I sort of picked up a few signs because I had another relative who had dementia. So I was a little bit familiar with some of the signs I began to see. But you know how you begin to doubt that, no, it couldn't be my dad. It has to be somebody else they're talking about. You're fighting the whole.
Can you tell us some of those early signs that you noticed?
Yeah, pretty much most of what Dr. Ajala said. They won't forget you so easily. Yeah, he forgot some of his children, I have to say. He couldn't remember my name up to a point. And then, I'd come to him almost every day. And when friends come and visit, I'd warn them and say, look, he doesn't know anybody. And they're like, no, he will remember them. And as soon as they start to talk to them, he just shut down. And then I pick up a conversation with him and he said, oh, Dad, when last did you see Yinka here? He says, no, she doesn't come here. I haven't seen her. So, then they realize that he really has forgotten things. He can't care for himself. So I had to care for him. Personal care, activities of daily living. He loved golf. He was a golfer all his life, and he couldn't recognize his golf bags anymore. He was a good eater. And so, I just tried to be sure that he wasn't hungry because I knew that would make him restless. Most of the time, by the time we found out it was that bad, with doctors' investigations, I think it had already gone far. In fact, I remember once his physician, when I asked a funny question, and he says, Yinka, the horse has already bolted. And I'm like, really? And I'm still seeing the man that I used to know. And I'm still wondering, what are we talking about? So generally, he became less interactive with people. He was usually an outgoing person, the life of the party, the person everybody went to, and suddenly he just started to shut down and didn't feel like talking or didn't understand what we were talking about. So basically, and of course, about the money, he'll call me and say, they've stolen all my money. And I'm like, no, that's not possible. And he says, no, you have to do something. They've stolen all my money. And then, you know, a lot of things.
Yeah. So no, I think that's so
Yeah.
you went on a journey though. So I know that we don't have much time, but can you give us sort of a synopsis of what you've learned and share with us some of the learnings you've had along the way?
Okay. I don't know if I understand the meaning of the word synopsis, but I'll try.
Summary.
Okay, great. Initially, I thought there would be a cure somewhere, hidden somewhere. So I started to go around asking all sorts of questions, attend conferences, exhibitions, took a short course at the Dementia School for Design in Scotland. Would attend the Alzheimer's show in London and just kept, you know, everything I was looking for was there must be an answer somewhere. And one day I met with a radiologist at the Alzheimer's show. And I went to her and said, there had to be a way out. And she shook her head and said, I'm sorry, you know, you just have to manage to take care of him. And that was when, I think that must have been 7 years after he was diagnosed, that it occurred to me that, okay, this is it. And then, you know, I stopped looking for a cure. And then I realized we were in for complete care, but I didn't realize how long it was going to take. So from the diagnosis in 2010, he did not pass until 2021. So it took another 5 years to wait through what I would think had gone on to about the 5th stage or so. I used to Google it and find out what to expect, or if I saw things, you know, and I remember I'd go through what to expect, and it would say to me, they would have difficulty with swallowing, and I'm like, how does that happen? And then suddenly he would start choking on his liquids. All the fluids he was drinking was almost choking him. And we didn't know what to do. We started giving him less to drink. And of course, he starts to get dehydrated, and that caused its own problems on its own. And we thought he wasn't, because by then he couldn't really speak anymore. But the eating was okay. It was just the drinking. And we got a carer to come and help us with something. There was a lady who used to come and train us regularly. And she said, oh, this man has dysphagia. I'd never heard the word before. And the next thing we knew, they're looking for opportunities. I mean, we're looking for how to get fluid thickness, because everything he drank, he was going to choke on, and he will cough until, you know, his eyes are watering and all that. And so we started to look for where to buy fluid thickness from. We could not find it in Nigeria, I'm sorry. So we started to send for, you know, would order a lot of it from the UK or the US. And that was how we managed him for another maybe about another 4 or 5 years until he passed. It was not something, what shocked me about dementia is I'd wake up every day to see that there was a new thing that was staring me in the face. And, you know, I call my siblings, oh, this is what we're dealing with now. Where can we do this? How can we get this? The carers in Nigeria, going back then, were not too familiar with the dementias. And so I had to learn a lot. We all had to learn a lot and try and feed them information as much as, you know, we'll tell them, look, don't be scared. And, you know, and I usually told them, it's not you that will kill him. So if you made a mistake, it's not your mistake that killed him. We're dealing with a very complex situation. And I had to understand that myself, because many times would find all kinds of things. He used to come up with some sort of boils, which I think was called impetigo. And, that kept going back and forth. Of course, he had become fully incontinent. Apart from the...
It's tough. It's really been it's a tough journey.
It is.
But one of the things that you mentioned that's quite interesting was the accusations, because one of the things that people often talk about is aggression, particularly early on, that they get aggressive with people. Did you find that?
Oh, yes. Oh, yes. And I had to learn quickly to understand that it wasn't about me. And I didn't have to be offended by anything he said. And, I think I read somewhere where it says, it is the dementia. It's not about you. It's not him. It's the dementia. So if anything was odd or went wrong, I quickly checked myself, because it's easy for you to either get annoyed or get upset that, oh, what you're doing, blah, blah, blah. But, when I remind myself and say, look, it's not about you. You have to get through this and find a way to get through it. Then we found ways around it. I had a lot of friends I called who were doctors. Not many of them had passed through dementia themselves, but they were doctors, and they would tell me, do this or get this or don't do that. And, that helped as well.
Wow. I mean, we could spend all the time talking to you, but, unfortunately, you won't believe the time is already up. Just wanted to go back to Dr. Ajala. Dr. Ajala, I know your institute is a special gerontology one. Do you have things there, or are there things there that you can use to help people, to support people who have dementia? What kind of things do you advise? This is sort of like the last words you have to also wrap it up within, to give us last words for our listeners.
Last words, JBS Gerontology Center. So we have got a day activities unit, which I specifically wanted to set up, a dementia day activities unit. Because like I said, earlier, and like Sister Yinka has, first of all, dementia is not curable, but there are ways in which we can slow down the progression of the disease. There are ways we can reduce that, acceleration, so that, let's say it was going to take 5 years to get to that stage where it's really so bad. Maybe we can slow it down enough so that we have a slightly longer time when it's manageable. So we have a dementia day activities unit, and that unit is available 3 times a week. We have people there who've got memory issues that come in, and we engage them in brain stimulating activities and all sorts of other activities. This is in addition to also giving some, medical treatments, as in medicines, that help to slow down the progression of the disease. And we've had excellent testimonials from those who have been attending that day activities unit. And so that's one thing we have at JBS Gerontology Center that is different to others, because there are lots of day activities units, but with ours, we have a specific focus on dementia. The dementia day activities unit. We actually call it the memory day unit. We have activities for others, but those are on other days, yes.
Thank you. Sister Yinka, do you have any last words for our listeners?
I would say to most people to, first of all, be very vigilant with their parents. And the only way you can do that is to become very patient with them and not wave off everything you see with, oh, they're just old, oh, she's, grandma is just like this or like that. Pay attention to a lot of things and listen to them. Yeah, it gets exhausting. Yes, it gets tiring. Sometimes it's like a waste of time, but that's where to pick up the few things. I like the way Dr. Ajala says the interventions for perhaps slowing down the rate of progression of this neurodegenerative disease. And it's the best thing is just to carry on, take every situation one by one, find out about it, ask questions. The Gerontology Center will be a very good help. Ask friends. Unfortunately, people are very shrouded in
secretive.
And that doesn't help at all. In fact, that's the worst thing to do. Don't lock people up. Don't shut them away from family members. We've heard a lot about social interaction. That's the only way to get them decluttered with the depression issues that maybe set in. Generally, I would say be open, find ways to learn. I became very friendly with them at the Yaba Neuropsychiatric Center. I'm not afraid to walk into that unit anymore. Before, I used to be worried about going to Yaba Left, but I find that it's a very, very friendly place to go to. That's the kind of place I had access to back in 2010, 2011. Otherwise, I think what worries me the most is, how to use lifestyle choices and things to learn to hope that we can all prevent this dreadful disease that's progressing at an alarming rate from happening to any of us.
Thank you. Thank you very much. We really appreciate your sharing. Thank you. Thank you for coming from the Gabi Williams Alzheimer's Foundation to talk to us. Can you tell us a bit about the foundation and how many people it has supported in the past?
Thank you so much for having us. My name is Peter Olania, and I'm the Senior Officer of Gabi Williams Alzheimer's Foundation. Gabi Williams Alzheimer's Foundation was founded in 2017, precisely September 2017. And it was founded on the basis of the works and life of late Dr. Gabi Ayodele Williams, who lived with dementia till the end of his life. So the foundation was formed by Dr. Mrs. Abisola Gabi Williams, the wife, and the children in their efforts to contribute to the support of awareness and infrastructural strengthening in Nigeria. We have two primary missions: to reduce stigma of Alzheimer's disease and promote awareness and advocacy. Secondly, it is our priority also to ensure that infrastructure and caregiver facilities are being strengthened in Nigeria. This, we believe, will contribute to the quality of life and quality of care of people living with dementia. Our activity cuts across various platforms. We have advocacy and awareness. We have research. We have policy.
I'd like to, if you don't mind, I'd like to just narrow down onto the caregiver, because I know that you do a lot of work with caregivers, and through them you support others. Can you tell us a bit more about how you train caregivers and how through that path you support people with Alzheimer's disease?
Okay. All right. Thank you so much. Precisely, our contribution to skill and knowledge transfer has been tremendous over the years. We have our faculty that is made up of diverse individuals from various occupations who are specialists in their various fields. We have geriatrics, we have occupational therapists, we have clinicians, we have neurologists, we have social workers, and all these people we put together to ensure that we have quality training for caregivers at interval. This, we believe, will increase their productivity and also enhance the life and the quality of care they deliver to people living with dementia. Also, we support families of people living with dementia as well. Because in our platform, in our social media platform, we put together families of people living with dementia. We link them up with various specialists in these fields in our social platform across board, WhatsApp and Facebook, so that they can exchange ideas, they can seek opinions, they can support one another, and also seek professional advice where needed and where necessary. And this, we believe, will increase the quality of care they deliver to people living with dementia at every point in time.
No, I don't doubt it. So what kind of people normally come for this training? Is it just anybody? For example, if there's a family listening now and they're thinking, you know what, my parent or my spouse, you know, is going through this. Let me start developing. I can see the signs. I can see it coming from what I've heard today. And they want to key into your foundation to help them. How can they reach you? How do they get their person in to take advantage of this training?
All right, thank you so much. We are not clinicians, and so we don't run medics and clinical advisory services. But mostly what we do is social support and connectivity. And so what we do while training them, basically there are two forms of caregivers, the primary caregivers and the secondary caregivers. And so both primary and secondary caregivers, we ensure that we interwoven with their curricula in a way that they will be able to deliver and take care, adequate care of their LOs. For instance,
we agree, we appreciate that. But what I'm saying to you is, how can they reach you? Is there a phone number? Is there a, how can they reach you to take advantage of your training?
All right. Let me take that again. Sorry. Gabi Williams Alzheimer's Foundation is located on number 4, Idowu Martin Street, off Adeolodeku, Victoria Island. And we have our website, www.gabiwilliamsalzheimersfoundation.org. We are also on Facebook, WAF Community. We have LinkedIn, and we also have our official phone numbers. Getting to our website gives you every information you need about us, and we are readily available to support individuals that tend to join our community.
We have another gentleman on, Raphael. Are you there? Your experience with us. Can you tell us what has been your experience with dementia?
My mom was diagnosed in early 2020. That was
how old is she?
Mom. She'll be 43 next month.
Okay. And what kind of signs and symptoms did she display at that time, and how is she now?
Well, before she was diagnosed, she had diabetes and high blood pressure. When I moved out of the house, because I had to move to law school, she sort of she became she was depressed because I wasn't doing her fun. I was talking to her on the phone, but then it wasn't the same. So when I returned home, I found that she sort of emaciated, she wasn't feeling well. Probably thought I didn't think any. It was different, but I just felt maybe it was because of the lockdown and whatnot. So much later, I noticed that she couldn't perform very regular tasks. Like she couldn't charge her phone, she couldn't use her remote, she couldn't read. And I knew something in that. So we had to go to the hospital. So when we got to the hospital, that's the Nigerian hospital, that the reference hospital in Alakija. So that's where she was pre-diagnosed with PCL dementia. So that has been the situation since then.
And how has it been caring for her? Has it been difficult? Are you the primary carer, secondary carer? How are you taking care of her at home?
My mom has just 2 children, myself and my sister. So my sister is not in the country. She is with her family in Canada, so it's just me. I work far away from the house, so I was able to get someone that would live in the house with her and take care of her. So I classify myself as a secondary caregiver.
Okay, so thank you very much for that. I know it can't have been easy for you, and I'm hoping that some of the information that you've heard on this program would be helpful to you, and perhaps you might even want to consider, linking up with the Gabi Williams Foundation for some support. Do you think that would be of value?
I think it should be, but I don't. My outlook towards it's pretty dismal. Watching my mom repeat every day, so it's not. I don't exactly have any. Or as much as possible, I try to make as comfortable as I can in the process. But I don't think I'll be reaching out to them.
Okay. Well, I don't know how to put it, but I know that it's tough. I can hear even from your voice that it would really be great if you could have some support. So if there's any way, the Gabi Foundation will be there to Gabi Williams Foundation will be there to support you if they can. And but I'd like to say thank you very much for coming on the program to share your experience with us. And I'd just like to encourage you to reach out and take advantage of whatever you can. There's no cost to it at the Gabi Williams Foundation. So it's something they do to support, because they've been through it, so they know what it means. The family have been through it, they know what it means, and that's why they're trying to reach out to help.
Thank you very much.
Thank you, Raphael. Thank you very much for sharing.
Thank you for watching. Please like, share, and subscribe for new video updates.